Hi, I'm Dr. Kelly Starrett from the Ready State, H-Wave Human Performance Advisor. Today we're talking about some of the things that I can do to facilitate feeling better if I've got foot or ankle pain. Now, the key here is understanding that oftentimes we're seeking H-Wave treatment because we've got congestion in an injured area, or we're managing a chronic condition, or I've got new onset pain surgery. And oftentimes what happens is that we can't really load the tissues of the ankle, of the foot. We can't exercise them in the kind of ways that would be appropriate for a return to normal function. And so what we can do is actually, instead of just saying, hey, there's nothing I can do here, there's actually a lot we can do in the terms of some soft tissue input to make ourselves feel better and to secretly get some loading, and more importantly, tell our brains that it's okay to move the tissue. So one of the things that we love to do is integrate a concept called isometrics. And isometric is just creating tension in the system without actually seeing movement across the joint. And so if you're standing, that's an isometric position of the ankle. You're maybe loading the ankle, but you're not actually moving like you would if you're walking. Now again, one of the things that happens when we have an injury or surgery to a site is oftentimes we can't get the kinds of loading or the kinds of functionality out of the system for pain or swelling, or because we're trying to protect the area. So this is a great place to introduce some isometrics. Now, you've probably been living under a rock if you've never seen someone use some kind of foam roller rolling device. And typically we use these things in the situations of the idea of recovery, that I'm trying to delay soreness after a hard workout, or we see athletes doing it. But in this situation, I want to show you a couple techniques that allow you to find aspects of the tissue system that may benefit from input through this isometric sort of contraction model. So here's what I'm going to do. I'm just going to put my calf up on here. And even if I had an ankle problem or a foot problem, I can probably still load my calf, with the understanding that a lot of the musculature that's driving and moving and steering the ankle and the foot actually resides above the ankle. It's like a puppet. The same way your forearm is really responsible for the driving and movement of your hand. So one of the things that we can do here is not be overwhelmed by how much real estate or how many muscles are involved, but I can start anywhere in here, and what I'm going to do is start rolling side to side across that tissue. Now, some of you will be able to handle large loads across the tissues, and some of us might be a little bit more sensitized or easily sort of surprised by the fact that it doesn't take much to feel something uncomfortable. And what I'm doing here is looking for something that feels uncomfortable. That might be painful, that might be tightness, that might be discomfort, whatever the language is. And when I discover it, that's okay. What it means is that my brain has found some area that's sensitive to compression. So as I begin to roll back and forth, I identify an area that feels restricted. Now, again, nothing is wrong with this area, and if it's uncomfortable to compression, I found an area that can be improved, or an area that might benefit from some input. So what I'm going to do here is, instead of sort of moving away from that site, I'm going to pause, take a 4-second inhale, and I'm going to contract. And what that means is I don't have to move the foot, I just have to flex the muscle into the implement, the roller, the ball, or whatever. And I'm going to hold that for 4 seconds, and I'm slowly going to exhale for 8 seconds as I slowly relax and melt. Now, what's happening here is a lot of complex physiology. I'm getting isometrics. I'm teaching my brain it's okay to contract here. I'm working on local musculature functions like trigger points. I'm also engaged with some breath work, which we know can also help me to feel better and to change sensitivity in a tissue system. And what I'm going to do then is say, I'm going to stay on that spot and repeat that 4-4-8 contract, relax cycle until it starts to feel better. And that means that it may be less discomfort, it may hurt less, it may start to feel good and pleasurable. And once I've done that, I continue to move on. Ultimately, even getting as little as 5 minutes of work in an area can go a long way to make you feel better.